Not into long podcasts. Don't worry, we've got bite sized clips just for you. This is CWN Clips. Please don't forget to subscribe. So I think I've researched about you, and when I started looking at what you're doing, especially from India, and also contributing to the International Society of the Simulation. So probably, and on your, I mean, it's an important area. The field where you're in is much more very critical care and pediatric critical care and emergency care, right? So that's a very demanding area to be in. So I want to understand how you got into why you chose the pediatric critical care as a specialty, and also your interest on bringing a lot of simulation in that area to India. So maybe walk us through your journey, doctor.
Okay, wonderful. So, as you all know, emergencies can happen at any time, and we find that parents feel very helpless. As a doctor, as a pediatrician, when I trained, I found that, this vulnerability and there is a need. It requires a special personality for you to like equip yourself to handle this. And when I was a trainee, I found that the routine care I was able to very comfortably do it, but when it came to emergencies, it required like quick thinking, compassion, empathy, and also making sure that you have a set process and you see the response and you know how to evaluate. It required a lot of focus, and when you do it right, and the way the child responds was very satisfying. So I thought I should be doing more of it, and the more I did, the more I learned how to do it right, and like how when I don't do it right, how it impacts. So that's how I got into pediatric critical care, and I realized that it's one of the niche specialties, and the more I did it, the more I adapted towards what was required of me. So that's how I went into pediatric critical care. So that's my journey from my training, where I looked after sick children, got the amazing satisfaction, and then refining it and re-refining it. That's where I am.
All right, I think it's a probably it's a great journey when you actually touching lives. I mean, medicine itself is a very profession which I really, I mean, everyone respects, but I also have very great respect for healthcare professionals and doctors and surgeons who are constantly saving lives and trying to touch many lives and families, right? So, and especially with children newborn, and it's a very delicate situations when you actually handle them. I think any specific moment you think, okay, hey, the satisfaction during your journey which has shaped your career as well, so do you want to call out or talk about that?
There are many such moments that make me feel very satisfied when I get it right. But of note, maybe when I started in my training, I looked after like a very sick. I trained in the UK, and my first step was to make sure that we learn the steps. There are various courses that train doctors on how to handle emergencies, but you learn it in the course, and when you actually do it on a real patient and how you see that change. So I looked after a very sick, what is called a meningococcal septic shock, and that's probably a nightmare of an emergency for any pediatrician or any clinician. And unless you get all the steps right at the right time, you make a big difference in the outcomes. And I looked after a child that was extremely sick, and it was one of those days where I had to transfer them, and and I thought that this child may not survive even the ambulance trip. But we ended up making a very successful trip, and the child did well. And when the child was getting discharged, the family just kind of got back to me and thanked me like anything. And I thought, oh, I just did my job, but it impacts this family to this extent. That was the one that like made me realize that you just don't treat the child, you go beyond and treat the family as well. So that was one of the like life changing moments when I decided to do intensive care. And if I look back, having been a trainee, and recently I looked after a child in my own hospital at Astor Whitefield, and this child came in like comatose, and we didn't have a reason as to why this child who was like playing and doing everything just suddenly became comatose. So we had to go through a few a series of tests and then give the treatment. So a child that came so sick, and then within a month he needed PICU care for nearly a month, and we had to like escalate all the care, give various medications that include fighting the immune system. And after all these therapies, which are available in very few select centers and requires a very curated and personalized approach, this child is now going to school. So this family, like on September 6th, came back and they gave a very nice appreciative certificate, which is all framed, naming every single doctor and nurse that was there in our unit. Very satisfying. And the father's, expression of gratitude, was just very pleasing.
This is just a glimpse of one of the many conversations we've had in this channel. If you found this thought-provoking, please don't forget to subscribe and explore more insights from unfiltered voices and the real-world experts. And please don't forget to like and share this video to as many people as possible. It keeps us going. See you in the next one.